So I've had Crohn's for 14 years now. I was a really active kid. It was kind of shocking when I suddenly couldn't move and was having so much pain. Almost missed about a month of school my junior year. So I was flaring all the time. I had mono at one point. I couldn't be in any of my school activities. I danced since I was, born. Practically, it's what I remember doing growing up. I went on prednisone, gained 40 pounds, didn't look like myself. And so ultimately, it just didn't work out and I couldn't keep dancing, which is kind of sad. Crohn's influenced a lot of the decisions I have made up until this point. Chose to go to school still in the Midwest, so I wasn't too far. Didn't feel like I was able to travel to the far spans of the U.S. Just in case I got sick.
Well, I've known Sydney for quite a while, and she has Crohn's disease, and one of the challenges that we've faced together is how to control this condition, but also something else that she has, which many patients with inflammatory bowel disease have, which is another part of their body that gets involved from the disease itself. And in her case, it was the skin. So looking at the skin and the bowel, what we've started to learn about in taking care of people like this is that's a clue to what might be driving the underlying problem in the body. So instead of just focusing on the bowel like a gastroenterologist would do traditionally, we think about the whole person. And by doing so, we end up thinking about new treatment strategies and more successful ways to take care of her. The Gastrointestinal Research Foundation is one of the most unique organizations of its kind in the United States. Well, over the last few years, we've taken the organization to the next level. We developed a grant cycle where people apply for funding. And since we've been doing that, we have not only been able to fund more science within digestive diseases, because this funding was available, it attracted people in other disciplines to do work in digestive diseases. What we do is extremely efficient. We move dollars donated into the hands of investigators in record time.
It's really just taking big chunks out of what I was able to do. I didn't go to school for about 2 months in a row. I was getting bad grades. I was so sick. I was fatigued. I was having trouble going to work. I was really into lacrosse, and then over my sophomore year for high school, I had a flare-up. I couldn't play my high school season, and then in my junior year, once again, it flared up. Definitely the thing I hate most about it is the fact that it took away my lacrosse seasons, because that was a very fun thing for me.
So when I first met Gage, I remember vividly how pale and thin he looked, how devastated his parents were, and how frail he was, and how much a diagnosis of ulcerative colitis impacted his life. On the first intestinal ultrasound exam we did, it was evident that he has quite severe disease.
Being introduced to ultrasounds to see what's going on, it just makes it a quicker doctor's visit. It's not as much stress either, having to go through the prep.
What's unique about intestinal ultrasound is that you can assess how patients are doing in the clinic visit and get an objective assessment of how things are going, whether the disease is active, whether therapy is working, and in those who've had surgery, you can see if the disease has recurred.
Right now, I'm almost perfect. I play my season, I'm having fun with friends, I'm going to school. It's really just a great thing to be back.
GERF-funded research is making a real difference in patients' lives right now.
I've had medication changes a lot in the last few years. It kind of gets to you. You get down, you just think you're never going to find something, and research could find a cure. That would be the biggest thing. Because that's a big ask, I would say, just continually finding ways to improve quality of life. I would hate for anyone else in my situation to not feel like they can move abroad or just explore and be youthful or whatever. So I'd hope that research will continually add to the possibilities of people's lives so that they don't have to feel trapped.
Ideas that are funded by GERF are those that need support in the initial phases. They're often high risk and we hope higher reward. And regenerative medicine is one of those campaigns, and the work that my lab does, I like to believe, is work that will be high reward, but will need that funding mechanism to generate the data needed to be competitive at the federal level. The first grant from GIRF really set up this idea of how do we find the stem cells that are responsible for healing the patient's gut. But the main focus in the second grant is also to look at how the microbiome can influence the activity of those stem cells, because that represents a key from which you might open the door towards regeneration.
Our goal in taking care of people who have any digestive illnesses has been about providing them with an unrestricted quality of life, allowing them to do everything they want and more with their life and not be encumbered by their disease. The patient suffering from an illness is at the center of everything we do. So whether it's a study in the laboratory under the microscope or in a mouse, it always comes back to the single person who's living with that disease that we're trying to understand better. And that's what drives us, and thankfully that's what the GI Research Foundation makes possible.